The SCORE study was a trial to assess the combination of Durvalumab, an anti-PD-L1 antibody, with different other modulators of the immune system. One that we focused on, and we'll present in more detail at ESMO, is a drug called AZD9150, which is a STAT3 inhibitor. The reason to combine that with a PD-L1 antibody is that we know that STAT3 is an important mechanism for immunosuppression, especially around myeloid-derived suppressor cells. So the idea was that if we could combine an agent that stimulated T cells, an anti-PD-L1 antibody, with an agent that would affect the tumor microenvironment in a positive way, we may be able to see additive or even synergistic activity. The first part of the study, of course, looked at safety and the ability to combine the agents without undue toxicity and tolerability. And in fact, the phase 1 portion of the trial was completed successfully. And then the study expanded into several cohorts, beginning to look at efficacy in squamous cell carcinoma of the head and neck. It turns out that the efficacy that we witnessed in the patients who had not been treated with an anti-PD-1 or an anti-PD-L1 antibody in combination with this STAT3 inhibitor was actually quite impressive. We saw a response rate of about 30%, with many of those responses being complete responses. Some of the other interesting aspects of the SCORES trial, especially in this cohort that combined Durvalumab with the STAT3 inhibitor, was that the responses were seen in both PD-L1 positive and PD-L1 negative patients, and they were seen in both HPV positive and HPV negative patients, suggesting that the efficacy may extend across a broad range of patients with recurrent or metastatic head and neck cancer. In fact, the response rate is perhaps double or even triple what we would expect with an anti-PD-L1 antibody alone. So we are beginning to believe that there is real merit here to take this combination forward into larger studies.